Hi, my name is Keisha Richardson, and the topic that I've chosen for my research is how does wraparound holistic care benefit children who've experienced trauma? This is important to social work because holistic care management isn't something that everyone has a good understanding of. Normally, when you think of holistic, you would think of it in medical terms, but in this case, holistic care is working on the person as a whole and not just focusing on one thing with the individual. It's also important to social work to help social workers have a better understanding of exactly what the holistic approach is and as well as how to use it when dealing with clients who have experienced trauma. So, the purpose of this study is to better understand how trauma affects the child, and not only how it affects them currently, but also how it will affect them as they transition to into adulthood. So, the method that I used for my research was an explanatory quantitative approach. I conducted a pre as well as a post test, um, and then I also did analyze the pre test. Um, the limitations for this study were that there were very few participants, as well as not knowing any environmental factors that could have played into. So, with these questions, these are all questions that um, just help to give like a better idea of your client and like what they're dealing with, and what exactly like domains should you be more focused on when it comes to using the holistic approach. So these are the domains and subdomains that are the main focus when using the holistic approach. Um, so the subdomains are what get rated on a scale of 1 through 4, with 1 being the worst and 4 being excellent. So my participants in my study, they were between the ages of 11 and 13, and they were all children who had experienced some form of trauma in their life. And I mainly chose participants that I did school check ins with. For my results section, the domain that I saw the most increase in was related to school, um, and as well as um, asking like, how has my field placement helped help like influence um, the scoring of my research, such as communities of belonging, as well as school check ins, were a really big one. So for my discussions, what I had seen that was kind of a struggle was with the domain dealing with self-regulation was a really big one. But there was an increase in the academic growth of each of the participants, as well as an increase in spiritual growth. So, in conclusion to my research, holistic care is going to vary from person to person um, due to external factors and environmental factors that they might not have control over. Um, Also, that some clients in some areas um, could improve while others in certain domains could not improve. And these are my references.